Now moving on to the ball and socket mechanism of the shoulder. Many times, if you have a contact athlete or somebody that gets hit or falls on an outstretched extremity, there is a likelihood of a shoulder dislocation. That occurs when the ball and socket mechanism is disrupted and this ball either pops out posteriorly or anteriorly. When it does this, it usually will take a portion of bone of this cup here or a bumper of tissue from that cup and displace it. And that makes that patient with a higher likelihood of redislocation at a later time. Most young patients that have this type of injury have around an 85% chance of redislocation after a primary dislocation. If you continue to play sports, that likelihood increases significantly. So for most patients that are high contact athletes that have a dislocation, eventually should get a stabilization type procedure. The good news is the majority of these procedures are performed arthroscopically through some poke holes in the shoulder, where we actually recontour this little bumper back here to give the shoulder once again support, and that keeps it from popping in and out of joint. The problem with living with a dislocated shoulder and not treating it is that, especially if you're young, you will develop arthritis in the long term due to the instability of the shoulder. Particularly the more common it dislocates, every time it dislocates, the cartilage, which is the soft rubbery surfaces of the bone, will eventually wear down. When that wears down, sometimes you even get wearing down of this cup. When this portion of this cup is dislocated, or when the portion of this cup is worn down, you think of it almost as if like a golf ball on a golf tee. If you have a normal golf tee and it's intact and you lay the golf ball on the golf tee, it stays on the tee and does not roll off. If you're missing a portion of that golf tee and you're missing the circumferential, you're missing this portion of the circumference, that golf ball will roll off that golf tee and will not be stable. The same thing occurs with this socket here. If you're missing a portion of the bone, or if you're missing a portion of the soft tissue constraints that hold that the ball and socket mechanism intact, you have an unstable shoulder, which increases your likelihood of arthritis. If you are missing bone, then sometimes it may require a different surgery, and that surgery is what's called the Latarjet procedure, which is it's a French term for what we actually do. And in essence, all it is creating a bone block or grafting a piece of bone to the front of this cup so the shoulder doesn't pop out of joint. Now that is an open procedure, and it does require a small incision in the front of the shoulder where we actually remove this portion of the bone and we swing this portion of the bone in front of the cup here to keep the shoulder from popping out of joint. Usually this is not a first time surgery unless you're missing bone and have had multiple dislocations over time, or you're a revision surgery where you've had it treated previously with arthroscopic surgery and that did not work, and you've developed instability due to another fall and that previous surgery did not hold, and you're missing bone. Then we usually rely on this. This usually allows a very fast incorporation of this bone and gets you back to contact sports after fixation and stabilization of the shoulder. So as always, do your due diligence in picking your surgeon, discuss your surgical options, and never ever hesitate in asking for a second opinion. If you have any questions regarding any of these issues, please feel free to contact my office. Thank you.